And now we're focusing on your health. If you have varicose veins, you know they can be unsightly and also painful. But today, we have helped to get beautiful, healthy legs. We are joined now by Dr. Dale Payne and patient coordinator Maggie Sorden. They're here with more. Thank you both for being here. We appreciate it.
Well, thanks for having us. Yeah.
And doctor, I know you're a cardiovascular surgeon. You're one of the surgeons who treats venous disease, the Arizona Vein and Laser Institute. Let's talk about kind of the type of vein issues that you do see at Arizona Vein and Laser.
Most of the people that come and see us complain of generalized aches and pains of their legs, sometimes restless leg syndrome. But a lot of it has to do, and they know they have varicose veins because their mother did or their family did, and they know they have problems with some of it is pretty ugly looking, and some of it is not so bad, but definitely blue veins, sometimes very achy, sometimes ulcerations around the ankle.
But
at the worst.
It's easy to get rid of them.
Absolutely.
When you come to Arizona Vein and Laser, because you treat them and it's a pretty quick treatment.
Yes, it is. They're individual treatments. We usually do one major vein at a time, but we do it with laser. We do phlebectomies where we actually take out the vein through a tiny little Nicken type incision on local anesthesia, and we can also give injections called sclerotherapy.
And we have a before and after photo too, just to kind of show you a typical patient. Tell me what we're seeing here and if this is a typical patient.
Yes, they come in with veins that look like that. Not all of them veins are that big. Some are much, much bigger than that. Some are smaller than that. And we were able to treat this with a combination of a phlebectomy and laser treatments and some sclerotherapy. The leg didn't turn white.
Yeah.
So I don't want people to be confused that we bleached it or something like that. The leg is the same color that it was before. But it's
different lighting to where you can't see it. But you can see the big vein that was there before, and that's what we're pointing out here. What about downtime? Is there anything that people have to plan for that?
Not really. The treatment itself is about a 45-minute treatment per treatment, and they wear an ACE wrap or a support type hose after the procedure. Most people go back to work that day or the next day, and we encourage people to walk. We encourage them not to lift anything heavier than 10-15 pounds for about 2 weeks anyway. So no real heavy lifting, but they can go back to work, and there's no real downtime.
Yeah. And the thing is, if right now you're sitting there going, I need help, I want to get rid of this, I've been putting it off, Maggie, you can get in. I mean, if they call right now, they can get in usually.
Today.
Yeah, today.
Absolutely.
You guys always make sure you do that.
Absolutely. We offer free visual vein screenings 5 days a week, Monday through Friday. You can give us a call and we can get you in the same day or next day at one of our locations.
And you have a free screening too if maybe you're not sure.
Absolutely.
Tell me about that.
Free screening. So one of our physicians, depending on the location, will take a free visual examination of your legs and kind of talk to you about your symptoms and the treatment that they would recommend from there.
Excellent. Well, thank you both for coming on. Again, Arizona Vein and Laser Institute does have 4 locations around the valley. For more information, to schedule a free vein screening, go to arizonavein-and-laser.com or call the number on your screen. Hi, I'm Destry Dijon of Arizona Midday. We're now focusing on your health. If you have varicose veins, you know they can be unsightly and also painful, but today we have helped to get beautiful, healthy legs. We're joined now by Dr. Dale Payne. He's a cardiovascular surgeon and is one of the surgeons treating venous disease at Arizona Vein and Laser Institute. Thanks so much for coming in.
Well, thanks, Destry, for having me.
Tell me about the type of problems that you treat.
Well, most of the people that come into our clinic are people who complain of varicose veins, and they're a lot of times they're very obvious, sometimes not so. People with varicose veins complain of achy legs, painful veins in their legs, blue discoloration, sometimes restless leg type syndromes that are caused by varicose veins.
Is it easy to treat?
Absolutely. Most of the veins we can treat one of 3 ways. Either by laser, where we inject a small laser fiber into the vein, phlebectomies, where we can make a little nick incision under local anesthesia, or sclerotherapy, where we inject a sclerosant into the vein itself, especially a small vein, a superficial vein, to make them disappear over a period of time.
Painful downtime?
Downtime, most people go back to work either the same day or the next day.
Oh, wow.
They should wear some type of wrapping, at least for the laser type treatment, for 2 weeks, but that's worn during the daytime. Some type of support hose. In terms of painful, a needle stick.
And that's it.
That's it.
And it's very easy to treat. And the best part is there are 4 locations in the Valley. In Surprise, Glendale, Avondale, and Phoenix. You can get an appointment same day. Call to get a free screening too at the number on your screen.